Hello, I'm Kira Baldonado, Vice President of Public Health and Policy at Prevent Blindness. Welcome to the Focus on Eye Health Expert Series. Today, I'm joined by Dr. Maria Sampalis, and we're going to talk about women's eye health and safety. Welcome, Dr. Sampalis.
Thank you for having me. It's an honor to be here today.
April is Women's Eye Health and Safety Awareness Month here at Prevent Blindness. So, as an optometrist, can you explain some of the unique vision and eye health issues that women have?
Yeah, a fun fact is that women in the US on average live longer than men. So they tend to have more age related eye diseases like macular degeneration, but also throughout life, very hormonal changes can change from, pregnancy, menopause, even with birth control use can cause tear production issues, dry eye. And I've seen that women post menopause are twice as likely to develop dry eye than men. In my practice now, I have a dry eye setting clinic, and I started to notice that I do. I see more women in my practice suffering from dry eye than men. And it's been a good practice builder to be able to discuss these issues with my female patients. And I think that the female patients want to have a female doctor sometimes because I can relate to them.
Dry eye is one of those things that people think they may be able to take care of themselves. It's not a big deal. But what are those symptoms that should be getting people to make that appointment with their eye care provider to check out if this dry eye issue is going to be something significant for them?
Usually, patients will go over the counter and look for products to help them, but it's irritating because a lot of people are on the computer. A computer causes dry eye. Again, hormone fluctuations can cause the tear production issues. Inflammation as well as cause a lot of dry eye. Things like that cannot be solved from over the counter and need to seek a professional care to help you with that. But also the new evaporative dry eye, gland dysfunction, things like that are all things that your eye care provider can help you with.
Talking about those hormonal changes. So let's start with women who are experiencing pregnancy. What are some of the vision changes that women who are pregnant may notice?
Yeah, during pregnancy, hormone levels can alter the strength of a woman's prescription as well. I talk to patients and tell them, your vision prescription can change. We talk about that. But they also, again, get dry eye, puffiness around their eyes are common side effects from hormonal changes while they're pregnant. Some women might notice more increase in migraine headaches, which is very common and very sensitive to light. And obviously, during pregnancy, we also look for gestational diabetes and high blood pressure as well.
Gestational diabetes may not be a term people are familiar with. Can you tell us what that is?
It is diabetes that women get during the pregnancy if their sugars go too high.
So let's talk about that later end of the hormonal spectrum. What about menopause? What are some of the effects that menopause can have on vision? I'm especially interested.
Like we said before, postmenopausal women are twice more likely to develop dry eye than men. It really impacts eye health, primarily due to declining estrogen and androgen levels. And approximately 61% of perimenopause and menopausal women are affected by dry eye. An increased risk of AMD as well from estrogen levels being lowered as well.
A lot to consider there. So, what are some of the questions that women should be asking their eye care provider about their eye health? What are some of the common questions you hear, but what are those things that you should be hearing from patients?
Yeah, I think we get patients that a lot of concern. Just getting routine eye exams are important. A lot of them need to know about family history. Family history and eye health is very important, right? If a patient has a family history of glaucoma or macular degeneration, you need to let your doctor know. That is very important. I have patients that I just saw, they're 30 years old. I diagnosed them as a glaucoma suspect. We always ask about family history. The patients didn't know. They did while they were dialing, text their family members and found out that the family members do have glaucoma. And those are good things to know as an eye doctor, be able to diagnose a disease earlier and provide treatment for them soon for better outcomes for them as well. And also talking about lifestyle changes that can help their eye health if they're more prone to macular degeneration, sunglasses, nutraceuticals, talking about screen time, that's very important as well. And understanding that the eye is as a whole to the body. It's just not for that too. We diagnose a lot more other diseases systemically from the eye.
Oh, wow. What are some of the other conditions that can be diagnosed just from looking at it in the eye?
So obviously hypertension and intracranial pressure. I just had a young woman come into the office, no complaints. She had increased cranial pressure. I could notice it from swelling of her optic nerve. Did it did a visual field the other day and thought that a patient might have a brain tumor in the back of the eye. So we sent her for an MRI as well, waiting on those results. Hopefully I'm wrong. It comes back normal. But these are all things that we diagnose and just with a routine eye exam. And, we can save lives.
Those eye exams aren't just for eye health, they're for overall health. So get your eye exam today. So, talking about some of the other barriers that may face women specific to eye care, what are some of the issues that may be specific to women that cause them to have barriers to getting eye care?
Yeah, sometimes it's lack of awareness. Some people think they see fine, and that's what the eye exam is, just a refractive exam, and it's not. Again, it's eye health. A lot of times as well, it's cost and insurance issues. Sometimes they think that their insurance does not cover an eye exam, and it does, and they don't realize that they can be seen yearly just for routine checks. They thought it's more of a medical issue if they have an issue. But also sometimes women are the caregivers in the house, right? So they take care of everyone else before they take care of themselves. So those have been the lack of barriers for some women.
Oh, excellent. Yeah, and there's a lot of resources on the Prevent Blindness website to help with those too. So definitely reach out to the website. So let's talk about some of the ways that people might approach their healthcare. As we mentioned, people might think they can take over-the-counter drops for dry eye. We covered that. But let's talk for a moment about supplements and nutrition. So, what do we need to know about what we eat, where we buy different supplements, what we're choosing to put in our eye to make sure we're doing the right thing to maintain vision and eye health?
I think you need to get recommendations from your doctor. You don't just go over the counter and pick a product. You need to be in the know. I think genetics play an important role in knowing what outcome will be for nutrition and what you're predisposed to. If you're predisposed to macular degeneration, there are new studies, right? I think there's over the counter products to help with like zeaxanthin, lutein, omega-3 fatty acids, but we need to know what has the quality, what is the dosage, things like that. And your primary care physician and your optometrist can work together to help give you the right product for that. And a lot of times that helps being preventative care for future issues.
We talked already a little bit about genetics and the impact that can have on your risk for different eye diseases. So, beyond genetics, what are some other steps that women can take today to help make sure that they have healthy vision in the future? And we'll let the men in on this one. What can men be doing too to make sure they have healthy vision in the future?
Just getting a routine eye exam every year from an optometrist can help prevent a lot of future issues.
So, Dr. Sampalis, it's Women's Eye Health and Safety Awareness Month. So, on the end of safety, what are some things that women need to be paying attention to in relation to their eye safety? Maybe that has to do with use of makeup or contact lenses.
To protect people, sunglasses are very important, right? UV block that 400 is important, A and B for that, but also contact lens safety, right? I think daily contact lenses are the best option for our patients. They wear it for a day, less risk for complications, throw it out. Being fit properly by an eye care professional, the eye care professional will measure the eye, make sure that your contact lens fits properly, find the best lens for you. If you're not a candidate, your eye care provider will let you know. But there are a lot of different options for contact lenses, for dailies, weekly, bi-weekly, monthly. There's a lot of different options, and you want an experienced professional fitting the proper lens for your eye, and then also quality professional teaching you, if you're new to contacts, how to take them in and out, how to properly maintain hygiene and clean your lenses as well. I've seen a lot of infections over the years. Corneal ulcers can cause decrease in vision, and you don't want that. So getting a proper contact lens exam from an eye care professional is essential.
I know there's more to learn. What else would you like to share with our audience to make sure that they understand what can be done for women's vision and eye health and what actions they can be taking?
Yeah, I think advocacy is important. I think, it depends if you're a healthcare provider, getting information out there, education, being able to let patients know what your services, what you provide, and advocating for routine eye exams as well. I think access sometimes is an issue, but now with a lot of different opticals and doctors and remote care and things like that, people have access in the United States for these, but understanding that the eye exam is not just a refractive component, it's also an eye health exam as well.
Not everybody's a natural advocate. So again, I'm going to encourage people to go to that Prevent Blindness website. We have lots of resources for folks who are new to advocacy and want to learn how to take steps for that. So, well, thank you, Dr. Sampalis, for being with us today and sharing this great information. And as always, if there's any more questions on any of these topics, I encourage our audience to check out preventblindness.org. And thanks for being here today.
Thank you for having me.